Hi, my name's Jessica. I am reaching out to you from the Pediatric Primary Care Clinic, and I'll be doing your interview today. A few questions to start. Why would you like to work here?
I want to be a pediatric nurse practitioner in your clinic because I want to be a resource for families and children, and I love what I do. Um, I admire the work of other providers here, and I think that I'm thoughtful, motivated. I like working on a team. I'm eager to learn, and I have years experience as an inpatient PDRN and have done well in my nurse practitioner program.
That's awesome. Um, Another question, why did you choose the pediatric care track?
I actually decided to be a nurse practitioner before I even entered nursing school. And then when I became a nurse, I really fell in love with just family-centered care and the age range for required of the pediatric nurse. And I want to be a nurse practitioner because I love the freedom it allows me to really help people and to be a resource for people. I think I was like called to do it.
Awesome. You seem very excited about your pediatric career. I think that's great. What do you feel is one of your greatest strengths?
Um, Probably being like self-determined. I work well on a team, but I'm also um, I'll I'm self-motivated and will complete a task like myself with patience and um, I think one of my weaknesses is being critical of myself when I'm not able to like complete a task as I would have liked, or an outcome changes. I like reflect on that and like maybe internalize, like criticize my actions a bit. But I see that as a strength too. Um, but I could work on being as understanding with myself as I am with my patients.
Most definitely. Criticism is, we can be harsh on ourselves. Um,
Yeah.
all right. So moving on, where would you like to be 3 years from now?
Well, I'd like to be settling into this pediatric nurse practitioner position at this clinic, gaining confidence as a new provider and improving my skills and education through my workplace. If you have any trainings available, that would be great. And then continuing education. At this point, I would have also liked to establish relationships with my patients and families.
Awesome. Sounds good. Um, how do you think a friend, professor, or supervisor who knows you well would describe you?
Um, I think people that know me well would describe me as honest and focused. Once I won a superlative at work for being cool as a cucumber in high stress situations. Um, I think, although our profession is stressful, I do get stressed. I try not to let it like overcome me on the outside and um, you know, being honest is really important to me. If I see something that's like unjust, I just like need to say something about it and be an advocate.
I think we need a lot more advocates in nursing, most definitely. Um, I know you just said it, but in what type of work environment are you the most comfortable?
I would say like naturally being in a environment where people work together well and they're kind to each other. I like being transparent. I like transparency. So if I'm not doing something correctly or the way I should be, I appreciate like clear feedback rather than like silence or indirect comments.
Um, And final question, describe a situation in which you recognized a potential problem as an opportunity and what did you do?
Um, so as an inpatient pediatric RN, I worked with a lot of um, mothers who had babies who were withdrawing from drugs that they had been on during pregnancy.
Mhm.
And I remember working with this particular mom who was taking care of her baby but was falling asleep. She was um, not able to really like safely care for her baby because she was so sedated, and she was on Suboxone in a recovery clinic, like in a medication assisted program, which is great. She's like trying, her best to take care of this baby. And so I remember getting social work involved and trying to see if maybe they could talk to the patient and then talk to her program if that was okay, and look into getting the dose lowered like safely, or if she was on too high a dose in the first place.
Yeah.
And so she ended up doing that, and the dose was too high and it was lowered, and we were actually able to see her um, like become more lucid and be able to care for her baby like safely within a matter of like 24 hours.
Awesome.
Yeah.
I feel like that specific population is a tough one to begin with, where people kind of overlook a lot of things. So that's great.
Yeah, and pass judgment and stuff.
Mhm.
Yeah,
Yeah.
sure.
Well, I enjoyed hearing all of your answers to my questions. Do you have any questions for me?
Yeah, how did this position become available?
So this position became available because we actually had a person who was looking to find work in a different environment. So we're looking for, new grads that are looking to gain experience and skills and stuff like that. So we're looking for pretty much you.
All right. And who else would I be working with in the clinic?
So you'd be working with obviously, our nursing staff as well as our MDs, basically in collaboration with them at all times. And obviously, our pediatric population along with their parents. Um, and being transparent, like you said, that kind of helps parents feel a little bit more at ease. So hopefully you can bring
Yeah,
that to the table.
great. And then how would you describe the work environment in the clinic?
So our work environment in this clinic is very open-minded. So we communicate well between our staff members. We like to hear, if there's any problems going on, or if you see something that needs, things could be changed. We love to hear new ideas about any of it. So
Oh, good. That sounds like something I would be interested in.
awesome.
Um, what would be the next steps?
So the next steps is I would talk with our team, and we would, talk about what we just talked about here. And then we would make a date for you to come in and kind of meet everyone, and they can kind of chat with you more, find out more information about you, or if you have any questions for them as well, regarding working together, education, training, stuff like that.
All right.
Yeah,
Well, thanks so much. I appreciate your time.
awesome. Thanks. All right, so we are switching interviewees.
Yes. So I'm going to be the interviewer. Um, all right. Hi, Jessica. I'm Kathleen. I'm going
Hi.
to be interviewing you today.
Okay.
Um, we're at the um, the ICU at a local hospital.
Awesome.
All right. So why do you want to work here?
Well, So my current specialty is adult geri acute care nurse practitioner. And I truly enjoy working with the most critical patients, making sure that, they're stabilized and that they can have the best positive outcome to go home with. Um, and if obviously if they are not stable and their outcomes aren't great, we make sure that they have the best quality palliative care or comfort care that we can give.
That's great. Thank you. I know you just touched on this a little bit, but why did you choose this career track?
So prior to me becoming a nurse practitioner, I was an LPN for a long time in nursing homes. Um, I started as a CNA. I worked up from CNA to LPN, and then I went back for my RN. And I've been working in the emergency room for 3 years. And then I decided, I think I want to go back and get a more critical care aspect. So hopefully I can kind of gain more experience in the critical care as a nurse practitioner.
That's great. We need more critical care nurse practitioners, especially for adult geriatric.
Yes.
What is your greatest strength, you think?
I think my greatest strength is I am very determined with all of my education. You know, I've had kind of sidetracks in my education along the way, um, milestones that I've kind of had to overcome. So I'm very determined in reaching my goals and making sure that I have the best education possible. Um, and I obviously won't stop until I get there.
Good. Um, and what would be a weakness?
A weakness I would say is so I am not one to really work well, not work well. I'm not one to engage in conflict, I guess. I think that's one of my bigger weaknesses.
Yeah.
I try to avoid conflict, but I know that that's not the best action.
Mhm.
I think that could be something that I could work on and kind of gain better structure around that.
Yeah. I think it's a hard thing for everybody
Yeah, no, you don't want to argue with anyone or kind of get in the middle of anything.
living in human nature.
But
All right. And where would you like to be 3 years from now?
well, 3 years from now, I would truly like to be working in the ICU, um, gaining further education from my peers, from my colleagues, hopefully gaining the best experience through patient care I can. Um, Also, continuing education is important, and I look forward to learning new things throughout my career. So, and I don't want to ever stop learning.
Yeah, the hospital is a good place for that.
Yeah.
How do you think a friend, professor, or supervisor who knows you well would describe you?
Um, I think I think they would describe me as a very hard worker, dedicated to my goals. I work well in a team. Um, I don't mind bouncing ideas off of my colleagues and, picking up wherever they need me to be. Um, yeah.
Great. Um, and what type of work environment do you think you're the most comfortable?
Well, I think I'm the most comfortable, and this may sound kind of funny, but I think I'm the most comfortable in chaotic situations like
Well, you're
traumas
an
or codes.
ER.
I work in the emergency room, so it's a chaotic place, but I'm very calm in code situations, in trauma situations. I don't panic. But that's kind of where I enjoy being.
Great. All right. And then lastly, describe a situation in which you recognize a potential problem as an opportunity. What did you do?
So, I had a patient who was deteriorating pretty quickly, and one of the doctors that we work with in the emergency room, He wasn't seeing what I was seeing, and he kind of was being more lax about the situation. Um, and I had to advocate for her multiple times to make sure that we were kind of targeting where her deterioration was. And the patient actually, she ended up being intubated. So my action in that problem was to really try and push the doctor to see what I was seeing and to make sure that he was targeting her treatment to make sure that there was a positive outcome. Unfortunately, um, there wasn't a good outcome, but I think without my advocacy for the patient, it would have gone much quicker.
Mhm. And a huge opportunity for like a learning opportunity for you and the doctor, right? Yeah.
Yeah. Every time I see a similar situation, I kind of panic a little bit. Not panic in a way where I'm, getting all kind of nervous, but I see that and I want to treat it quicker to make sure that that patient doesn't, decline super quick.
Yeah. It's the part of the beauty of nursing, right?
Yeah.
All right. That's great. Do you have any questions for me?
I do. So how did this position become available?
We had an opening because one of our older nurse practitioners just retired. So
Awesome.
she loved working here and she's been here for 20 years and now she's leaving.
Well, that says something about you guys. 20 years is a long time to be in the same position. That's
Yeah.
a good thing.
Yes. We loved her.
Um, who else would be working? Who else would I be working with in this department?
In this adult ICU, there's four adult doctors and two nurse practitioners right now. So you would be working with six other providers.
Perfect. That gives me a good amount of people to kind of bounce ideas off of and learn from.
All right.
Um, how would you describe the work environment here?
We're, as any hospital environment is, we're very team oriented, and very like transparent with each other because, it's a very um, critical environment and we need to, speak as well as we can with each other. It's, you know, I think the providers find that they have a good um, work-life balance too. They're not bringing too much home with them.
That's good because as much as you want a positive outcome, there are many negative outcomes, and the fact that you have other people to kind of help you through it is it's a good thing.
Yeah.
Um, I'm very enthusiastic about pursuing this position with you. What would be the next steps in the process?
We are interested in you too.
Oh,
You
perfect.
just need to contact your references, and then I'll be following up with you in the next week or so.
Perfect. Sounds good. It was great to speak with you.
You, you too. Take care.
You too. Bye.